Good afternoon, and welcome to the first White House Africa Cancer Care Forum. I would first like to extend a very warm welcome to our many distinguished guests who have traveled very far to be here today. Your presence is a powerful testament to not only your commitment and dedication to improving cancer care in your countries, but also the health and well-being of your citizens. And we are really honored to have you with us here today. Today, this convening will not only bring together senior leaders from across Africa, but also U.S. government officials, international experts, financial institutions, and representatives from the International Atomic Energy Agency. It also brings many that are joining us via the live stream. So welcome to you, and we are thrilled that you're with us today. My name is Catherine Young, and I serve as the Assistant Director for Cancer Moonshot Policy and International Engagement. And although you cannot tell by my now very American accent, I am also someone who was born and raised for the first 18 years of my life in South Africa. And although I cannot speak to all the unique challenges countries in Africa may face, what I do understand is the incredible potential and opportunities that we have by us all being here today to forge new pathways for a better, healthier tomorrow. This forum is not just about discussion, it is also about action. It is about approaching the topic of this event, expanding cancer care and access in Africa with the urgency it demands and the optimism it deserves. By uniting our expertise, our resources, and resolve, we can create a future where cancer care is accessible, effective, and equitable for all, one of the core tenets of the Biden Cancer Moonshot. And talking about action, I would like to now introduce our first speaker, Dr. Danielle Carnival, Deputy Assistant to the President for Cancer Moonshot and Deputy Director of the Health Outcomes Division at the White House Office of Science and Technology Policy, who will formally kick off our programming today. Danielle, over to you.
Thank you, Catherine. I want to add my welcome to the White House to all of you. Thanks to, as Catherine said, so many who have traveled so far to be with us today in this historic room for a historic occasion and to share about the Biden Cancer Moonshot and all of the work that each of you are doing. We welcome in particular ministers of health and senior level leadership from Benin, Burundi, the Democratic Republic of Congo, Mozambique, Senegal, Rwanda, Tanzania, Zambia, and Deputy Prime Minister of Lesotho. The President and First Lady started the Cancer Moonshot because cancer is personal to them. President Biden made it a priority for his unity agenda because it is personal to virtually every American family. Driving progress against cancer is a global mission because it continues to directly impact tens of millions of people worldwide, an estimated 6% of the total human population. Now, while the immediate goals of the Cancer Moonshot are domestic in nature, focused on preventing more than 4 million American cancer deaths by 2047, the Biden-Harris administration's ambitions for our work to end cancer as we know it extend far beyond the United States borders. No one nation can solve this problem, as evidenced by all of you committing to this today, but together we can develop and share new ways to prevent, detect, treat, and survive cancer, and collaborate to ease the burden on people and their loved ones facing cancer, particularly in countries that experience a disproportionate number of global cancer deaths. That is why the global work of the Biden Cancer Moonshot focuses on equity and accessibility to improve prevention, early detection, screening, treatment, and care for everyone facing cancer. And so our commitment to reducing the burden of cancer in Africa took a significant step forward with the U.S.-Africa Leaders Summit in 2022, where First Lady Jill Biden and Second Gentleman Doug Emhoff announced commitments across U.S. departments and agencies and the private sector of more than $300 million to improve cancer outcomes across Africa. These commitments included new efforts to strengthen domestic public health infrastructure, build resilient health systems, invest in health workers, and fund robust and impactful initiatives across the African continent on cancer prevention, screening, treatment, and research. Today, I am pleased to share that the Biden Cancer Moonshot is announcing more than $100 million in new announcements as part of our continued commitment to join with you to reduce the burden in Africa. These commitments include new efforts to strengthen domestic public health infrastructure, to build resilient health systems, again, to invest in health workers, and fund robust and impactful initiatives across the African continent on cancer prevention, screening, treatment, and research. You will hear more about these commitments from my agency partners, including the Department of State and Department of Agency, as part of the program today. This builds on progress. Earlier this year, the Biden-Harris administration committed to work with Congress to pledge at least $1.58 billion to Gavi over the next 5 years, building on a 24-year partnership that has helped immunize more than 1 billion children and estimated to have saved 17 million lives. And with the collective support of partner countries, Gavi could vaccinate the next billion children in just a decade. With support from the United States and other donors from 2026 to 2030, Gavi aims to protect 120 million girls and young women from cervical cancer, including on the continent of Africa. But we still have so much more to deliver, and today we're here to continue to work together to build a better future, a future where the word cancer loses its power, a diagnosis isn't a death sentence, where we prevent cancer before it starts. We catch cancer early so people live longer and healthier lives, and people and families don't have to navigate their cancer journey alone. So thank you for being here. I'll turn it back to Catherine and look forward to hearing all of the outcomes from today. Thank you.
Thank you so much, Danielle. And now to kick us off with opening remarks from the Biden-Harris administration, it is my pleasure to introduce Christine Bent, Assistant Deputy Administrator for Global Material Security at the U.S. Department of Energy's National Nuclear Security Administration. Thanks so much for being here with us today, and over to you.
Good afternoon to everyone. Today we had intended to have our Deputy Secretary of Energy join us, but due to an unfortunate conflict, he was not able to join. It's truly an honor for me to be able to be here today to speak with you and to talk a little bit about some of the work the Department of Energy is doing to support this broader initiative. So I'd like to begin just by welcoming all of you to the meeting today. And I hope that you'll judge our city not by the humidity of the summer, that we're experiencing a major heat wave right now, but by the hospitality that you will receive from all of your hosts. And I know that many of you have come a long way to be here today, and I know that all of us would go to the ends of the earth to try to overcome this disease. Most of us have been touched, whether personally or through our own family members, by cancer. And it is something that really does unite us all in the concern of that happening. And it's also something that bonds us together with a sense of purpose. And that's why for the US government, we've been very focused on this and have contributed over $50 million to the International Atomic Energy Agency Rays of Hope project across the world, including a focus on partners in Africa. So as you may know, we are providing equipment such as linear accelerators. We're funding fellowships for medical physicists, for radiologists, and other staff across a range of disciplines to provide treatment and operate cancer centers. We're also thrilled to see the first IAEA Rays of Hope Anchor Center open in Egypt, and the announcement of 3 additional anchor centers, including the Steve Biko Academic Hospital in South Africa. But of course, we must do more. 70% of cancer deaths will occur in low and middle income countries, but these countries only receive 5% of the global spending in this area. In addition, more than 1/3 of IAEA member states have either expressed interest or requested assistance under the Rays of Hope initiative. And so today, I'm happy to announce that the United States government will contribute an additional $6 million to Rays of Hope in 2024. So this forum is really a chance for us to seize on this momentum. Ignited by the spirit of the President and First Lady's Cancer Moonshot, I hope we will identify new opportunities for collaboration, develop clever financing approaches, both public and private, and put radiotherapy, especially linear accelerators, within reach for millions more. It is not just a responsibility, but a privilege to be entrusted with helping save the lives of people we may never even meet. So let's meet the moment and show that no challenge is too great for the collective will of the human race. Once again, thank you all for joining us. We're very glad that you're here. And with that, I will turn it back over to our hosts. Thank you.
Thank you so much, Christine. And it is now my pleasure to welcome to the podium Ambassador Bonnie Jenkins, who serves as the Undersecretary of State for Arms Control and International Security, where she oversees 3 bureaus: the Arms Control, Deterrence, and Stability Bureau, the International Security and Non-Proliferation Bureau, and the Political Military Affairs Bureau. Ambassador Jenkins, thank you for being here, and welcome.
Good afternoon, everyone. It's really great to see all of you here. It's my pleasure to join all of you today in support of our shared commitment to ending cancer as we know it. For those of you who have traveled halfway around the world to join us for this meeting, thank you for the gift of your time and energy to this effort. We are pleased to use this opportunity to bring together leaders from African countries committed to expanding their national capacity for cancer diagnosis and treatment. We applaud your innovative approach to working closely with the IAEA's Rays of Hope initiative to advance your national cancer programs. We are also very pleased to have representatives from the World Bank and the Islamic Development Bank with us to share their experience and advice on financing cancer-related projects. We recognize that countries are tackling the cancer burden in addition to a wide array of other important development challenges, including, for example, priority programs in food security and water resource management. But we know that strengthening a country's national health system has an important positive impact on the national economy and well-being. And we know that health systems are key to resilience against a host of shocks and threats. We also recognize that in order to achieve improvement in healthcare service delivery, including cancer control, a country needs a solid and sustainable technology base and workforce capacity. This is particularly the case in advancing nuclear and radiation medicine as part of cancer care diagnosis and treatment. Advancing access to training and equipment to promote nuclear and radiation medicine to treat cancer has long been an important area of work for the International Atomic Energy Agency. This area of work is a stunning example of the mission of IAEA, Atoms for Peace and Development. Our support for IAEA's work in this area is a tangible demonstration of our international commitments to advancing the peaceful uses of nuclear science and technology under the Treaty on the Non-Proliferation of Nuclear Weapons, or NPT. Since it came into force, the NPT has served as a cornerstone of the nuclear non-proliferation regime. The NPT does more than offer a foundation to prevent the spread of nuclear weapons. The NPT's non-proliferation assurance provide a framework that promotes cooperation to advance the peaceful uses of nuclear energy, science, and technology to help address global challenges. The NPT affirms the principle that the application of nuclear technology for peaceful purposes is an inalienable right of all parties to the treaty. This principle is reflected in the commitments states parties have undertaken in Article 4 of the treaty, commitments that the United States is applying by supporting Rays of Hope and holding meetings like this one. To further demonstrate our commitment to advancing peaceful uses in accordance with the NPT, in 2022, the United States launched the Sustained Dialogue on Peaceful Uses. The Sustained Dialogue has held 3 events focused on advancing cancer care in West Africa since 2022, and more work is planned. The sustained dialogue may be an opportunity to carry forward work based on some of the discussions that will take place here today. Through bilateral engagements and multilateral partnerships, we work to fulfill our amputee commitments to facilitate the fullest possible exchange of equipment, materials, and scientific and technological information for the peaceful uses of nuclear energy, in conformity with the other provisions of the treaty. The IAEA is a key partner in our efforts to advance peaceful uses, and it plays a central role in global efforts to promote and apply nuclear science and technology for peaceful purposes. Through projects that cover a broad range of sectors, ranging from energy and resources to health and food, the agency helps member states work toward their development goals. In doing so, the agency serves to help the global community fully leverage nuclear technology in pursuit of the UN Sustainable Development Goals, the SDGs. Today, we highlight the IAEA's Rays of Hope initiative as a key mechanism for delivering the benefits of peaceful uses of nuclear science and technology to address the challenge of cancer care. Rays of Hope aims to leapfrog technology and capacity in countries most in need of assistance in cancer care, countries which have little to no existing capacity. By focusing on a limited number of high-impact and cost-effective interventions in nations that have little or no access to radiotherapy, Rays of Hope aims to help advance equity in access to cancer care globally. The U.S. government is proud to have supported Rays of Hope with over $50 million in extra budgetary contributions to help bring equity to global cancer care. And I am also pleased to join my NNSA colleague in announcing the $6 million in funds previously provided to the IAEA that we're adding to the Rays of Hope program. Already, our contributions are building capacity in Africa through the procurement of diagnostic imaging equipment and linear accelerators for radiotherapy treatment in Benin and Kenya. We hope the additional funding can further advance IAEA Rays of Hope work to promote equity in cancer care globally. More importantly, though, they are being used to train radio-oncologists, technicians, and medical physicists to cultivate the necessary workforce to fully utilize these new facilities. In co-hosting today's meeting, we are building connections between the IAEA work and the global initiative President Biden's Cancer Moonshot. The Biden Center Cancer Moonshot serves. The Biden Cancer Moonshot serves as a rallying call around which new partnerships have and continue to be forged, allowing those seeking to build or enhance cancer control programs to tap into more diverse funding sources. We are confident that working together, we can catalyze new support to ensure maximum reach, impact, and sustainability to work on these two initiatives. We believe that Rays of Hope can help to ensure that innovative cancer control solutions rising from the health, research, and energy communities are made accessible to all nations, including our partners in Africa. Critically, while the use of nuclear technology and science in radiation and nuclear medicine can significantly improve public health outcomes, it must be accompanied by rigorous nuclear safety and security measures to protect the safety of both health workers and patients. You will hear more about this important consideration later in the afternoon from my colleague, Commissioner David Wright of the Nuclear Regulatory Commission. We applaud the IAEA's Rays of Hope program for coordinating with experts in nuclear safety and security to consider, as part of the Rays of Hope package of assistance, appropriate additional support to the regulatory agencies in this area. Since the NPT came into force more than 50 years ago, significant advances have been made on the application of nuclear science and technology to help address national and global development challenges. And we applaud the tireless work of organizations like the IAEA in tailoring and advancing those applications to the needs of its member states, including providing technical support through programs like Rays of Hope. We require the unwavering commitment and collaboration of all those in this room to addressing the challenges and gaps in access to cancer care planning tools and assistance, to leverage available resources, including those from philanthropic and private sectors, to enhance national cancer care plans and ensure their successful executions. So I want to thank you all again for your time, your effort, and your brain power in being with us to work through these key challenges and exciting objectives today that will help improve the lives of so many. Thank you to the White House Biden Cancer Moonshot team for organizing this important meeting and for hosting us in this very historic venue. Thank you.
Thank you so much, Ambassador Jenkins. It's now my great honor to introduce next Dr. Miriam Mutebi. Dr. Mutebi is a breast surgical oncologist and assistant professor in the Department of Surgery at the Aga Khan University Hospital in Nairobi, Kenya. She also serves as the president of the African Organization for Research and Training in Cancer, or also known as AORTIC. Dr. Miriam Mutebi was also a recent recipient of the American Society of Clinical Oncology Humanitarian Award, a testament to Dr. Mutebi's unparalleled dedication and contributions to the field of oncology and cancer research. Dr. Mutebi, thank you for traveling so far to be with us here today. Welcome, and over to you.
Thank you, Catherine, for that very kind introduction, and good afternoon to you all today. I like to say that I'm in the hope business because for the longest time, the reality or the stories that we had about Africa and the association in cancer in Africa was that cancer equals death. Over the last 10 years, or over the last decade of practice, I'm happy to report that that is starting to change, and to really encourage all of us in the room to think about how we can collaboratively and effectively work together to shift narratives for patients, not just in Africa, but also across the globe. And I think to do that, we probably need to reflect a little bit on the patient journey. And with her permission, I will share Amina's story. Amina is a 38-year-old mother of 3 who works in rural Kenya, and a couple of months ago, while working on the fields, discovered a lump in her left breast. There wasn't much of awareness around cancer in her community, and indeed she did go to a healthcare professional who reassured her that there was no possible way she could have cancer at her age. And so after a couple of months engaging with the health system and a lot of uncertainty, she arrived at the diagnosis of a breast cancer. Now, I'm sure most of us in the room can begin to imagine the hurdles that Amina is likely to face as she moves forward. However, plot twist, I'm here to tell you that this is starting to change, and in the spirit of optimism, trying to outline what are some of the wins that the continent has had to date. One of the areas that we've seen is an increase in the number of national cancer control plans, which, as we said, is really a signal that policymakers are starting to see the importance of the cancer burden that's emerging. We're saying we had about 500 deaths by 2020, according to the Lancet Commission, and likely to double. So it's really looking at how are we then preempting this situation by coming up with plans that ensure not just prevention, but timely detection and treatment of our cancer patients and ensuring their survivorship. The other thing that we've seen is not only is the National Cancer Control Program, it forms the bedrock for really coming up with national cancer strategies. For instance, in Kenya, the National Cancer Strategy has now led to the regionalization of cancer centers of excellence, which ultimately has resulted in patients like Amina receiving care closer to home and ensuring that they're not having to travel long distances in order for them to access care, and minimizing the disruption to their day-to-day activities. The other thing that we're looking at is what is the, one of the things that we're noticing as well is the really robust grassroots advocacy. And all these incredibly brave men and women who are working in the community in conjunction with partners in oncology and the policymakers to try and make a difference on the ground. And they're going into the communities and talking to patients, raising cancer awareness, reducing cancer stigma, including even reassuring Amina's relatives that her cancer was not contagious, and ultimately supporting her through her cancer journey, such that Amina now has actually started her own civil society organization that's actually helping newly diagnosed cancer cancer patients to access care, and is actually a member of the technical working group of the Ministry of Health, where she sits and provides important information to policymakers about how to best treat patients in our setting. One of the other things we've seen is the expansion of the workforce, and we've seen over the last few years there has been across the continuum of care an expansion of the workforce, young and old, committed to really trying to shift narratives for patients. But in looking at that, one of the things that we've tried to do through the African Organization for Research and Training in Cancer is really building that continental community such that we're able to leverage technology and innovation to get opportunities to have shared knowledge and actually ensure that this percolate down to our patients. One of the other considerations around this is really thinking through, despite all these gains, we do have a couple of challenges, but it's really thinking through how do we start to address these, because we still have the conversations around equity. Despite the advances that we've had, we do know that only 5% of the global oncology resources are being spent in countries that have over 70% of the deaths. And I'm grateful to hear the increased engagement and interest in increasing funding, but it's looking through how do we then start to amplify that across the region. We also note the lack, despite the increase in the workforce, we are seeing considerable deficits still in Africa across the entire continuum, and it's looking through how do we then leverage that, how do we train, retain, and maintain our oncology workforce. We have seen an expansion and interest, and we have seen the rise of oncology training programs that have actually helped to, in-country training that have actually tried to ensure retention of the workforce. But then how do we look at getting more practical solutions that expand the skill sets across this region? One of the other things that we want to consider is really looking at how can we collectively start to ensure that all our efforts really put patients at the center of our endeavors. And part of this, one of the missing gaps is really around cancer research. We don't really know. Patients, clinicians who practice on the continent anecdotally will tell you about our drugs react differently, our patients not behaving according to what the books say, but you'd be, I think we should be outraged to know that cancer research comprises only about 8%. 8% of cancer research in Africa comprises only about 8% of the global research, which is really an opportunity for us to think about how do we shift narratives for our patients. And of that 8% of the global research done, 3/4 of the research done is only from 5 African countries. I believe that's really an opportunity for us to think through how do we create models that can enhance both research, service delivery, and care for our patients. If hope is the thing with feathers, then I think we need to think creatively for all of us in the room about how do we work together to raise the collective around access to care in a safe, timely, affordable fashion, and how do we then start to change narratives for patients across the world. Ladies and gentlemen, thank you for your time.
Thank you so much, Dr. Mutebi. And now I'd like to introduce our next speaker, Dr. Lisa Stevens. Dr. Stevens serves as the Director of the Program of Action for Cancer Therapy at the International Atomic Energy Agency, or IAEA. Prior to this position, Dr. Stevens spent 24 years in a number of roles at the National Cancer Institute, including in the Office of the Director and the Center for Global Health. Dr. Stevens, welcome, and over to you.
Thank you, Catherine. I think we're going to start with the video from the Director General Grossi, please.
Everyone, I am delighted to have the opportunity to speak to you today on this important occasion, the opening of the African Cancer Care Forum. I thank the United States of America for convening this event and for your efforts in bringing together so many leaders from the health sector in Africa, the Biden-Harris administration, international financial institutions, and international organizations, including, of course, the IAEA. The International Agency for Research on Cancer has estimated that by 2040, we can expect to see more than 30 million cancer cases globally, with many of them in low and middle-income countries that lack the most basic diagnostic and treatment capacities. These 30 million people are not just a statistic. Over 70% of cancer deaths are in low and middle-income countries, yet these countries only benefit from 5% of global cancer spending. Global experts tell us that there is a shortage of over 5,000 radiotherapy machines, which limits access to quality cancer care. This is why, together with then-President Macky Sall of Senegal, I launched the Rays of Hope initiative in February 2022 on the margins of the African Union Heads of State Summit. I launched it because I am committed to doing everything I can to address unequal access to high-quality, life-saving cancer care. Where you live should not determine if you live. To date, 82 countries have asked to join Rays of Hope. 42 are from Africa, and 14 have been invited here today. I'm proud to tell you that we have already made significant progress in supporting a first wave of African countries, including through the delivery of Linacs, cyclotrons, and imaging equipment, and the provision of long-term training for medical specialists. However, much more needs to be done. We need you to help us reach our goal of preventing unnecessary deaths from cancer. Together, we can achieve many things. The IEA can offer the technical expertise to develop strategic funding documents and implement complex projects involving nuclear technology. The governments can lead resource mobilization efforts and create the necessary infrastructure, and international financial institutions can provide the critical financing which is required. These shared solutions are why I am delighted that we have been able to come together here today. We know this can work. Our support for the development of strategic funding documents has already yielded results, enabling member states of the IEA to raise more than 400 million euros over the past 20 years for creating or expanding radiotherapy facilities, and much more since we launched Rays of Hope. By combining a sustained commitment from governments with financial resources and technical expertise, we can deliver transformative change. Dear friends, supporting Rays of Hope is not merely an investment in technology. It is an investment in health, resilience, and sustainable development. In today's interconnected world, the health challenges we face know no borders. By working together, we can build stronger, more resilient health systems worldwide. Our collaboration is a testament to our shared humanity and our collective resolve to leave no one behind. Thank you for your continued support and commitment. Together, we can make a difference.
So good afternoon, Excellencies and distinguished guests. I will follow on the Director General's remarks. I want to start by thanking the health representatives from African member states, the Biden-Harris administration, the Islamic Development Bank and the World Bank, and the international and U.S. experts for their attendance here today. Your presence underscores the importance of our collective mission to enhance global cancer care. Today's meeting presents an opportunity to unite key stakeholders in tackling one of our era's most pressing health challenges, access to quality cancer care. By harnessing our collective resources and expertise, we can improve cancer treatment in Africa. Cancer affects individuals and families universally, regardless of borders or economic status. Our shared objective is to elevate the availability and quality of cancer care, ensuring equitable access for all. I do want to extend a special thanks to the United States for their strategic partnership and generous contributions to the Rays of Hope initiative. You've heard that to date, totaling over $50 million plus contributions announced today. We are so grateful for this steadfast support, which demonstrates the shared commitment to improving global cancer care. It's already catalyzed capacity building and procurement of equipment, fostering enduring improvements in cancer care infrastructure and capabilities, and inspiring other partners to join in support of Rays of Hope. As our Director General mentioned, Africa faces an escalating cancer burden. We've been working closely with African countries, those represented here today and others, and we understand that resources needed to address gaps in availability of high-quality treatment. Our commitment is to bridge these gaps and implement sustainable solutions in partnership with governments and others. An initial set of countries have already benefited since the launch of Rays of Hope initiative in February of 2022. Funds raised for critical equipment purchase and healthcare professional training for Benin, Chad, the Democratic Republic of Congo, Kenya, Malawi, Niger, and Senegal support timely and quality delivery of care. Several countries, including Lesotho, Malawi, and Niger, have contributed funding from national and developmental sources through government cost sharing with the IAEA, underscoring their commitment to advancing cancer care in their countries. The initial wave of support has laid a strong foundation for our continued work and has demonstrated the effectiveness of a collaborative approach. This has encouraged us to extend support to additional countries in Africa and to other regions that have requested to join the Rays of Hope initiative. The resources needed are increasing as we include more countries in Africa. As the DG noted, 42 countries from Africa have already requested support under Rays of Hope, and we estimate the total support needed around $600 million. The IAEA has contributed $31 million through our technical cooperation funds and extra budgetary resources, and we consider this seed funding to begin implementation through our technical cooperation program and want to further engage with international financial institutions and other partners, which are essential to secure the remaining resources. I hope the opportunity today to hear about these concrete needs from the countries will inspire follow-on discussions of opportunities for further collaboration. As noted by the DG, there is a role for all of us here today in a shared solution. The IAEA, in collaboration with member states, international financial institutions, the private sector, and other partners, plays a pivotal role in strengthening global cancer care. By aligning resources and efforts, we can achieve sustainable and impactful outcomes. The development of bankable documents or strategic funding documents have supported member states in securing over $430 million in the last 2 decades. These funds have principally come from international financial institutions with support from direct government contributions, as well as partnerships with foreign governments and the private sector. This is a great start. We need to continue supporting more countries without delay. There are challenges, such as insufficient healthcare infrastructure, a shortage of professionals we've heard already, delayed diagnosis, financial constraints, equipment and medication shortages, cultural and social factors, all of this with the urgent needs in cancer care. It is imperative to seek transformative change to address these challenges. So how can we concretely join forces? With member states leading the resource mobilization efforts, the IAEA can support at the onset with the development of techno-economic feasibility studies or bankable project documents, enabling member states to reach out to a variety of partners with a technically sound financial proposal. Then, as a technical partner, the IAEA can support in the design and implementation of complex projects involving safe, secure, and timely radiotherapy and diagnostic imaging. All of us in this room play a role, and those that aren't in this room as well, in ensuring that we are prepared to meet the challenge of the rising cancer burden. We know that large-scale financing is often needed to address the health system needs at scale. The strategic investments of the international financial institutions are pivotal in expanding access to essential healthcare services, including early detection, treatment, and palliative care across the continent. By mobilizing resources and fostering collaboration between governments, private sector entities, and civil society, these international financial institutions are instrumental in building resilient health systems that can effectively combat cancer and improve health outcomes for millions, including through funding training for medical professionals, supporting educational initiatives, and funding campaigns to raise awareness about the benefits of nuclear technology. We thank the Islamic Development Bank and the World Bank for joining the discussion today and look forward to leveraging our unique strengths to continue to support countries together. To ensure long-term sustainability, we're establishing anchor centers, long-standing partner institutions that serve as regional hubs for education, training, and innovation. Presently, 9 countries host anchor centers, 3 of them in Africa. And there's an opportunity for these countries and these anchor centers to work together in support of the success of cancer care expansion. Continued financial support is vital to sustain their pivotal role in advancing quality cancer care. We look forward to continuing the conversation at our next Rays of Hope Forum in 2025. This year's forum, we were able to raise awareness on Rays of Hope and advocate for attention to access to quality radiotherapy and imaging. We had a chance to review progress and highlight opportunities for partners to engage. The forum in 2025 will be another opportunity, and hopefully we'll have a visit to a facility that has benefited from support in order to see the fruits of the collaboration. In conclusion, the White House Africa Cancer Care Forum and the collective efforts of all stakeholders present today are pivotal in advancing our mission. By fostering robust partnerships and commitment, we can achieve sustainable strides in global cancer care. The road ahead may be challenging, but with our pledge for a shared solution and established partnerships, we at the IAEA are confident in our ability to overcome and make a profound impact for cancer patients and their families. So thank you once again for your dedication and support, and together we can turn the tide against cancer and bring hope to millions worldwide. So thank you.
Thank you so much, Dr. Stevens. And now we're going to turn our attention to our first panel session, U.S. support for capacity building efforts in cancer control in Africa. And with that, I would like to introduce Dr. Will Ngwa, who will serve as our moderator. Dr. Ngwa is one of the newest members of one of our newest agencies, the Advanced Research Projects Agency for Health, or ARPA-H. Prior to this recent appointment, Dr. Ngwa served as the global oncology researcher and medical physics expert at Johns Hopkins University and brings with him an incredible vision and tenacity around the power and importance of collaboration, as evident by the role as founder and director of the Global Health Catalyst, which is dedicated to catalyzing high-impact collaborations to eliminate cancer health disparities in both the U.S. and around the world. Dr. Ngwa, welcome to the stage. And with that, I invite the panelists to come to the front. Dr. Satish Gopal, Dr. Julie Graylow, Dr. Hedy Kurisak, and Commissioner David Wright.
All right, thank you so much, Catherine. I have to start by saying that this is a good day for US-Africa collaborations. Before we actually start this panel discussion on looking at capacity building support, I would like us to really appreciate what has just happened. We've heard some announcements, but I don't think there was a lot of enthusiasm from all of you. Can we just show appreciation for the announcements that have been made so far? Yeah, it turns out that when President Biden launched the Cancer Moonshot Initiative back in February 2022, we were actually just launching the Lancet Oncology Commission for Sub-Saharan Africa across several African countries with a number of ministers present here, like Minister Umi. And what it showed was that cancer is a crisis in Africa. 1 million deaths per year by 2030 if we don't do anything about that. I mean, 80% of kids die needlessly when they are diagnosed with cancer. Women, cervical cancer, we had a cervical cancer forum here. Women we know cervical cancer can be eliminated, women die is the highest cause of cancer death. Okay, so out of this commission, we actually realized that one of the key things, the recommendations, was collaborations. And today is a good day because we actually have a collaboration panel forum here looking at US-Africa collaborations. And this is really important. And so we are going to, I also want to mention that part of the inspiration for me being part of the new agency Catherine mentioned was really to do something about this. So APA-H, if you've never heard about it, is really focused on accelerating healthcare outcomes, better healthcare outcomes for everyone. Okay, so this is something that I'm really excited about. It was inspired by the Cancer Moonshot Office, and I think we really, this is something that we all can collaborate, to make a difference. So we have a distinguished panel here. These gentlemen and ladies have such extensive resumes that I'm not going to even try to read through all of those resumes. So the first thing I'm going to ask is that they just give a brief introduction about who they are, and then we can go from there. Starting with you, Dr. Satish.
Hi, everyone. I'm Satish Gopal. I'm at the National Cancer Institute in the United States. I direct the Center for Global Health. Before joining the NCI in 2020, I lived and worked in Africa for a decade as a medical oncologist who took care of people with cancer in the public sector, and a physician scientist who was generously supported by the NCI to lead a cancer research group. Thank you.
Hello, I'm Hedy Rissak. I'm a radiologist from Memorial Sloan Kettering. I'm also a professor at the Gerstner Sloan Kettering Graduate School of Biomedical Science. It's really a pleasure to be here. I was chair of radiology for 23 years, but always had a tremendous passion for global health. I was lucky enough that working with Will and some other in the audience was a part of several Lancet Oncology commissions. And that gave me a much deeper appreciation of the data and the tremendous need that we need to improve cancer care in Africa. And with that, I am really, really pleased to be here. Thank you.
Thank you very much. And good afternoon, everyone. And thank you for including me in this event. I feel a little overwhelmed because this is such a distinguished panel, and they're so much more educated than I am. My name is David Wright, and I'm a commissioner at the U.S. Nuclear Regulatory Commission. I'm also a stage 3 colon cancer survivor, and my oldest daughter, is a stage 3C colon cancer survivor. So I'm blessed to be here, to have the opportunity to pay it forward in the work that I do today. And because to me, all cancer patients matter, and we got to fight for the lives of each one of them. So I feel blessed to be able to be here to take part in this. For those of you who are not acquainted with the NRC, we're an independent federal agency that licenses and regulates the civilian uses of radiological materials, radioactive materials. And that includes what we're talking about here today, right? The medical use of nuclear material. I look forward to sharing what the NRC does and to hear what you're doing as well, and to share with you what we're doing around the world and with Africa.
And I'm Dr. Julie Graylow. I'm a medical oncologist and the chief medical officer at the American Society of Clinical Oncology, or ASCO. We are a professional organization for healthcare providers who care for patients with cancer. And although we have that A in our name, American Society of Clinical Oncology, we truly are a global organization. We have almost 50,000 members in 170 countries, and about 1,200 right now ASCO members are practicing in Africa. Our vision at ASCO is a world where cancer is either prevented or cured, and every survivor is healthy. So let's work together toward that vision.
All right, let's get right into our panel now. The first question I would like to actually ask to Hedy, who has been a global leader and currently co-chairs the Cancer Moonshot 2.0 Lancet Oncology Commission, which is the US Cancer Moonshot Lancet Oncology Commission. And so, Hedy, to you, actually, we really want to ask the question, why is this important? You know, why should we invest into cancer control in Africa?
Well, thank you, Will, and I'll try. One point I would like to make, that cancer is no longer a silent pandemic. In 2010, we had 10 million cases of new cancer. By 2022, we had 20 million, that's globally. It is projected by 2040, we'll have 24 million, and by 2050, we will have 35 million new cancer cases globally. So therefore, this is no longer silent. This is truly global, our crisis. Furthermore, in Africa, 70% of those new cases will occur in Africa. And to make things even worse, when we look at the cancer mortality, 2 incidents, then in Africa, on average, Africa is 2 times higher in cancer mortality, and for some cancer, common cancers, it is 4 times higher. Can we really sit back and look at those numbers and not do anything? And this is why we are so grateful to President Biden and the Cancer Moonshot extending it to Africa, because we can make a difference. All the data, all the numbers, I'm telling you, are all published. So in a Lancet Commission on Imaging, we did an evaluation and the modeling for 11 most common cancers. If we don't do anything globally, there will be 76 million deaths. If we intervene, and that means we invest in diagnostics, which includes imaging, and its early detection, in treatment, that we heard a lot, that includes radiation therapy, but equally surgery and access to medications, and in quality of care. Then we can avert 9.5 million cancer deaths, which is 12.5%. But if we introduce the same measures to Africa, then the benefit is 3 times higher at 35.7. So not only that we're going to save lives, but there is an economic gain for every dollar invested globally in improving cancer care. The return for every dollar invested is $12.5. In Africa, for every dollar invested, the return on investment doubles to $26. So if we look for the humanitarian part, if we look economically, how can we not invest? And therefore, once again, really, really thank you to President Biden and the Cancer Moonshot extension to Africa.
Wow. Wow, those are amazing numbers and data. I don't know how you put all of that in your head, Hedy. And I'm going, since we're talking about support for Africa, Dr. Satish, I'd like to ask you, you've been doing some really amazing work at the NCI. Can you highlight some of the initiatives that the NCI is doing around research in Africa?
Sure. Perhaps first I'll orient everyone to the NCI. I introduce myself, but not the organization that I work for. So the National Cancer Institute is a lead federal agency within the US government that supports and conducts cancer research. We believe that the NCI is the largest funder of cancer research in the world. And while much of our work is focused on domestic needs and priorities, we have always been engaged in international cancer research collaboration because we know that that is what's needed to really drive progress for people everywhere. The NCI has actually been engaged in Africa for many, many decades, including dating all the way back to the 1960s, where there were seminal collaborations that the NCI initiated in Ghana and Uganda that really taught us fundamental truths about cancer that still guide much of the way that we approach cancer even today. Those engagements have continued to this day, such that in the most recent fiscal year that we've completed, fiscal year 2023, the NCI was supporting nearly 200 projects, separate projects, all across the continent, touching on various aspects of cancer research and control. In general, these projects are focused on cancers that have an extremely high public health importance on the African continent. Cancers like esophageal cancer, breast cancer, cervical cancer, HIV-associated malignancies, liver cancer, prostate cancer, childhood cancer, just to name a few. Historically, a lot of this work that the NCI has supported has been focused on observational, epidemiologic, and etiologic studies. I think on this very strong foundation, what we've sought to do over the last many years is to build a more applied research portfolio that we hope will really generate data that is incredibly informative to policies and practices across the continent. And this includes, for example, major investments by the NCI to support new global health technologies. For example, the thermal ablation devices that are commonly used to treat cervical precancer now throughout the continent, new AI approaches to planning radiotherapy, which will allow for the efficient deployment of these many new LINACs and other systems that are coming online. We also have stood up major new programs focused on implementation science in recent years. That is, projects that are designed to test strategies for delivering evidence-based cancer control interventions with the kind of scale and sustainability that is really needed in Africa. And this includes things like HPV vaccination, breast and cervical cancer screening. So a large portfolio of implementation science that we've supported and continue to support. And then the third area just to mention is research that is focused on supporting clinical trials that will be informative to the continent. This includes efforts focused on cervical cancer prevention. This includes efforts focused on HIV-associated malignancies, where the majority of the world's burden is concentrated in Africa because of the concentration of the HIV epidemic in that part of the world. More recently, this includes newer efforts focused on cancer immunotherapy possibilities in Africa. So I think our portfolio is long-standing and fairly diverse, and hopefully these investments will continue to lead to important impacts on the continent.
Yeah. Thank you, Satish. And the amazing thing about Satish is that he's actually lived in Africa. You know, he's seen it, he's done it, so he really, you know, is really the leader that we need here. So I'll turn over to you, Julie. I know from the public, obviously from Satish speaking from the government perspective, you know, the private sector, President Biden said, you know, this is really going to be public-private, right? All of us have to do something about it. So can you say something about what ASCO is also doing around, you know, research and professional development in Africa?
Well, we decided that we needed to ask our African members what they wanted from us. So a couple of years ago, we established what we call our Sub-Saharan Africa Regional Council. And we have representatives on the council who advise us on what their needs are that ASCO can help fulfill. So research and training are very high on the list. One of the things the Regional Council did was select another International Cancer Corps site. An International Cancer Corps is a very strong relationship at an institutional level in capacity building, training, education, multidisciplinary care, and quality of care. So the Regional Council selected Black Lion Hospital in Ethiopia as a new International Cancer Corps site, and we're kicking off with that. We've had a long-standing International Cancer Corps site in Kampala, Uganda, at the Uganda Cancer Institute, and I was involved in that in my prior life at the University of Washington and the Fred Hutch, and our relationship there. And that relationship, a lot of it, in addition to capacity building, had to do with quality of care, measuring the baseline of what's being done, and then monitoring it and adjusting it where you see gaps and making quality improvement. So those are some of the things. The regional council also came to us and said, we have a lot of training in cancer research and clinical trials, but we can't compete with Americans for NCI grants or other grants. We don't have as many opportunities, and the questions aren't rated as being as important, questions about some things that are unique to cancer in Africa. So we were able to partner with industry. Pfizer gave our Conquer Cancer Foundation, through our Every Grant program, $1 million+ for several of our regional councils, and said, we're giving this money. The regional council can decide the priorities and review the grants and select the grants. We just want it to be in breast cancer. So what happened when we announced this in Africa was we first asked for letters of intent. We got 185 letters of intent. We were hoping to fund 10 grants. That just shows you right there the need and the interest. The regional council was able to whittle that down to 34 that they invited to submit a full grant, and we'll be reviewing those in early September in person at a regional council meeting. So these are just a few of the things with a little bit of a focus on capacity building and research and quality care that we are able to provide and working in partnership and in response to what we're hearing the needs are.
Yeah, thank you. So, and thank you for your leadership at ASCO. I mean, the model of actually first going to listen, and that's what we're doing here today. We're listening to African ministers, to the voices, before we kind of talk about what solutions to bring. It's really, really important. We thank you for your leadership for that. Commissioner Wright, you're really, really a powerful presence here because you also bring the patient voice. You've survived, and that's really, really important. But when we hear about the national regulatory authority, we don't think about cancer first, right? The Nuclear Regulatory Authority. So now can you share some, why the Nuclear Regulatory Authority looks at, training regulators as a priority?
Yeah, thank you for the question. And, as I'm kind of lucky in a way, right? Because I did survive colon cancer, so I have that side of it. I'm a survivor. But I'm also a nuclear safety regulator. And so I'm keenly aware right now of the need for strong healthcare infrastructure and for, effective cancer care, and that it is done safely, right? So many of you hear regularly, and I'm going to kind of quote this, but you hear from regulatory officials some, quote, like, effective, well-resourced, independent regulatory bodies are essential components of a strong nuclear safety regime as well as security regime. It applies in the medical world. What is often not known is how this goes beyond nuclear power and is inclusive of the medical use of nuclear materials. I am the beneficiary of the safe use of nuclear materials, as is my daughter. I want that to be available for everyone around the world. That's that's my hope and that's my goal. So as radiological material for cancer care expands, we've got to make sure, and the NRC has recognized, that these novel technologies are often first of a kind, right? Especially for some of our international counterparts. And so we've got to make sure that they know what it is, that their patients know what it is, that they understand why it's important to them, and get over some of the cultural fears that might be there. I think it's really critical because we don't experience that here in the United States like they do elsewhere around the world. I recently visited Ghana last October, and I was able to go to the Swedish Ghana Cancer Center there. And with the inspectors, the medical inspectors there from Ghana's Nuclear Regulatory Authority. So I have personally a deep appreciation for what these inspectors do. They have to be trained in how to inspect and what to inspect and why it matters. The caregivers or the doctors who are administering have got to be trained so that they can administer it properly and safely. The patient needs to receive the care safely. And then the people who are administering the dose or to the patient, they've got to be not just doing it safely, but they may have to be protected as well. And then after the procedure's done and the patient has received whatever nuclear isotope they may have gotten, their caregivers might have to be protected for a period after that as well. So the safe delivery of of these procedures and these isotopes are critical, and it means that we've got to make sure that every layer of that care is done safely, and that's what we do. We're going to make sure that it is done safely, that the training is done properly, and we're going to work very closely with our international counterparts there in Africa to make sure that they have what they need and that they are able to do the job that they want to do so passionately.
Yeah, thank you, Commissioner Wright. I mean, that actually echoes some of what Ambassador Bonnie mentioned, which I think is really, really important. We have to make sure that there's safety, and security of this. Nelson Mandela once said that, education is the most powerful weapon to change a society. And so as we think about training and capacity building, I want to come back to you, Hedy, and ask you, why is workforce development critical?
Well, we have a tremendous, as you know so well, and many of you in the audience, we have a tremendous global workforce shortage in healthcare, including our own country. But it's all amplified as we look at Africa. So it is estimated that 80% of patients in Africa do not have access to any oncology care. And it was recently published that the workforce shortage, now all healthcare workforce shortage in Africa by 2040 will be 6.1 million. There is no way that we can train in, less than 20 years, that we can train 6.1 million workforce. Just no way. Even if we do everything, as Miriam said, and the retention and the education and fellowship. So I think we live in the era of digital technology. And if you didn't read, I would really highly recommend to look at the recent report from the World Bank on digital technology, how to implement, and actually at the opportunity. We all talk about crisis in Africa, and it is a cancer care crisis. But it is also an opportunity for Africa to embrace digital technology, to embrace not just AI, but the workflow, to redesign the workflow. As World Bank report says, there is an opportunity for Africa to leapfrog all of us that are struggling with changing the rules that have been in for years and the culture that is just resistant to change. And if you think it's not possible, I always like to quote Nelson Mandela, it is not possible, it is impossible before it's done. And I really think that combination of absolutely education, combination of putting in place retention. Equally important, we have to put in place continuous medical education, not just once. So create fellowships, doing what ASCO is doing, what Miriam is doing with the aortic, because then we create a global community and we can exchange our knowledge. We learn from Africa. We need Africa clinical trials because we don't have enough diversity in our trials. If we are really going to use AI ethically and applied to diverse population, we need African data for those AI algorithms to be applicable to our own Black population. So we need you as much as you need us. And I think it is a win-win situation. And remember, digital is coming, and those really digital platforms are going to make you leapfrog what we have in this country.
Yeah, thank you, Heidi. I mean, I think AI really has a transformative impact. We can really leapfrog, if we engage that. We can bring an exponential solution to a problem that, is really a big problem with workforce development. We're just going to go around now very briefly, 2 minutes. Satish, what are some areas where the NCI is collaborating with, governments and international organizations in Africa? Because we know the African saying says, if you collaborate, you can go further. Even win-win. Can you share some examples?
Sure. Well, thanks, Will. So the NCI, I mean, all of the work that the NCI supports is done in collaboration with governments. I think the typically grant applications that we receive include letters of support. The investigator teams that are leading the work often are working closely with ministry colleagues. All of the research that the NCI supports gets input and review by local ethics committees. So none of the work that the NCI supports or conducts can be done without the buy-in of local governments. And then the complement of that is also true. So it is also true that NCI-supported investigators are often playing critical roles in their local national cancer programs. And I think we have actually evidence of that in the room today. So Dr. Mutebi, Dr. Lorenzoni are both NCI-supported researchers who are also playing key roles, I think, in their own national environments. Often people who might be conducting NCI-supported research, for example, in cervical cancer, are then also chairing the National Cervical Cancer Control Committee. So we think this is a completely bilateral sort of relationship where we benefit from your support, and hopefully some of the investments that the NCI is making are informative to national cancer control plans. Perhaps a couple of other things are worth mentioning, just to wrap up. The NCI, together with the Union for International Cancer Control, for more than a decade has supported something called the International Cancer Control Partnership, which is a group of international organizations that provide support to countries as they're developing, implementing, and evaluating national cancer control plans. This has seemed to lead to a marked increase, as Dr. Mutebi mentioned, in countries that actually have national cancer control plans. That is very different now, the landscape, than it was 10 or 15 years ago. We think that the ICCP has contributed to that. Many of the countries represented at today's meetings have participated in ICCP, both to draw support from ICCP as they've been advancing their own plans, but also then sharing their experience in a way that has been very valuable for the ICCP community overall. And then another thing just to mention is the NCI has a strong historical and ongoing relationship with aortic. Perhaps it's never been stronger than currently during Dr. Mutebi's tenure as president. So the NCI, together with aortic, initiated an award many years ago called the Big Cat Award, which was designed to provide catalytic funding to early career researchers in Africa, asking and answering important local questions. We're an important supporter of the biannual aortic meeting, which is probably the preeminent cancer conference on the continent. Typically, each meeting includes a number of NCI and aortic co-convened sessions that give us the opportunity to feature NCI-supported research teams and results that are generating evidence that hopefully is informative to the policymaking community across the conference. At last year's meeting in Dakar in November, we had a large NCI contingent and a number of NCI and aortic co-convened sessions. So those are just a few examples.
Yeah, thank you, Satish. Thank you. All right, I'll ask the same question to you, Julie. ASCO has been doing some, collaborations with Africa. Can you highlight some of those?
Partnership and collaboration is our whole strategy here. We have an MOU with Aortic as well. We heard from their president, Dr. Mutebi, earlier in this session. That MOU mainly revolves around training, mentorship, and research funding. We're very excited. This is a relatively new MOU. We have a partnership with the Union for International Cancer Control's ATOM Coalition, Access to Oncology Medicines. ASCO doesn't go out and get the drugs, but our involvement there is in capacity building and quality care. And this does involve MOUs with the government of the first 3 countries that this ATOM Coalition, Access to Oncology Medicines Coalition, will launch in. One of them is in Africa, Zambia. And then there is another group of 10 capacity building countries that are part of this project. And in that group of 10 are Uganda, Cote d'Ivoire, and Senegal. So African involvement there. And then we also have a strong partnership with something called City Cancer Challenge. So instead of partnering at the national level, we partner at the city level. The whole city agrees to focus on tackling cancer. And again, ASCO is involved in multidisciplinary cancer management and leadership development there. And there are 3 African cities currently participating in the City Cancer Challenge, Kigali, Nairobi, and Kumasi. So those are just some of our important collaborations where we're contributing on the African continent.
Yeah, thank you, Julie. Commissioner Wright, I know that we've, you have already some partnerships going on, which are bilateral. Can you just highlight some multilateral initiatives that you have that may involve Africa?
Sure. Thank you so much. And before I answer, I just want to compliment Dr. Mutebi. Your calmness and your quiet confidence is something that reminds me of my own personal oncologist, and I cannot wait to work with you internationally. So over the past couple of decades, the NRC, we've accepted or assisted countries establishing and strengthening their programs, getting set up for the very first time, and especially over the use of radiation sources and X-ray generators that are used in the medical field. I mean, it includes a wide range of training that can be tailored to focus the unique needs that you have, that our counterparts have. And within Africa, the NRC is partnering with 18 countries right now on such capacity building efforts, and I'm pleased to say that within the next 10 months, our agency plans to provide training on the licensing and inspection of linear accelerators, PET machines, interventional radiology, brachytherapy for 10 of our regulatory counterparts in Africa, and some of them are represented here today. We've got Malawi, Mozambique, Senegal, and Zambia, I believe, are in the room, which I'd love to hear more from them. And I'd love to, for those of you who want to work with us, to reach out and let's see what we can do to help you and assist you as we go forward. So,
thank you so much. Yeah. All right. I'm told our time is up. I'm sure that you guys have a lot of stuff that you could continue talking for a while. But I just want to end by echoing what we heard earlier today about this is just the beginning. I mean, these initiatives we're starting is really an important step. I think we all, even those who are, anybody can contribute. I think that's what the president said. By calling, I mean, the Cancer Moonshot is really a good opportunity to rally everybody, to mobilize people, but all of us can do something about it. So this is just the beginning, and let's thank the panelists once more, and then we'll transition to the next one.
Thank you so much, Will, for leading that panel so expertly, and to all of our panelists for sharing your incredible work, expertise, and actions that you are taking in Africa. Throughout this session, we have also, or at least I, have been inspired by the insights shared by our speakers. Thank you, Danielle, Christine, Ambassador Jenkins, Dr. Mutebi, Dr. Stevens. I think you really captured exactly why we are all here today and why we are doing the work that we are doing, but also making it clear what is left to do. Today's live stream session has certainly underscored, I think, a really crucial message. Collaboration is our most powerful tool. Cancer is not confined by borders, and neither should our solutions be. By working together, sharing knowledge, we can create a world where cancer care is accessible, effective, and equitable for all. Thank you for being a part of this first part of the program, both here in the audience and to those of you from the live stream. And with that, this live stream will now come to a close. Thank you.